Healthcare in Grenada is quite costly. Government is ensuring that citizens who can afford to pay make their contribution. However, wheels are in motion to make healthcare affordable to those citizens who cannot afford the high costs. Jude Williams is among many senior citizens unable to afford to pay for his medical needs. Williams says he has lost his job several years ago and has since been unemployed, fending for himself. A task that is becoming harder each day as he is now 67 years and partially disabled. He is dependent on government aid to provide for his basic needs and says he has not made sufficient contribution to the NIS to receive a pension.
You know how hard it is, eh? When you are diabetic, you have to get your insulin. Sometimes when you go up there for a day, they tell you it in half, you know. You have to get something. You have to get money to buy insulin. And it's a hard thing for me to do.
He now struggles 3 times a week with crutches to walk up to the health center at Pedmata St. David to receive treatment for his foot, which was partially removed due to the complication of diabetes.
And then again, sometimes too, I don't really mind because I have form of exercise in it. And as a diabetic, you have to exercise, you know. So that will help me a little bit, the walking, so I have to force and fight to do it, you know.
Adding to his woes, Mr. Williams says he has been without running water and electricity for over 10 years. When asked about his family, he had this response.
So me alone here. I have a boy and a girl, but they live with their mom, and them do study me. Sometimes I have to beg them to pass. I have to beg the girl and the boy to pass by me, and they still look coming. So mostly everything in me. Every night me alone here. Yeah. Sometimes you really. And then you have a lady down on the side on me, back the collar, Alice. Sometimes she does help, you know. Sometimes she drops some food.
During last week's post-cabinet briefing, government announced that it is set to launch the National Health Insurance in the first half of 2017. Health Minister Nicholas Steele said a proposed budget of $500,000 has been allocated for the establishment of a secretariat to move the agenda forward. Minister Steele said an actuarial review must be conducted to determine the actual cost of healthcare in Grenada as part of the implementation process. He also addressed what is in the pipeline for those who cannot afford healthcare services.
The public system, the government public system, medical system in terms of healthcare being offered will no longer, once you introduce health insurance, will no longer recognize whether a person can afford to pay or not. Will simply recognize that the person is covered by a national health insurance.
Williams hopes that he will live to see the benefits of affordable healthcare for the less fortunate in Grenada. Colin Campbell, GBN News.